Okay, so what are we looking at? Well, firstly, it's not my image, so I have to say thank you to Ed. He doesn't know me, he's never met me, but I'm going to credit him because he has offered his free creative expertise and skills to fellow, I don't know, folk like me who want to share beautiful images, histology images, and spread the excitement of histology without incurring what's the word? Don't know the word. You know, the world is just so eager to bash you the moment you infringe on copyright, and rightly so, I suppose. So Ed Uthman, thank you for this image. I presume it's a Dr. Uthman, because your images are histological. They're and what we're looking at here is it appears to be the lumen within I'm guessing a gastric mucosa. The inscription read Helico Bacter Pylori. Now if you look at this little, they look like these little let's use the graphite pencil. They look like these little seagulls or birds. It reminds me of my late dad's. One of his favorite albums was a Jonathan Livingston seagull. It looks a bit like a seagull to me. So this is for you, Dad, too, who passed recently from COVID. I think today is the 9th of September. He passed on the 12th of July. And he was also in the medical field, so he would enjoy this analogy. And it's a common infection in patients with peptic ulceration and gastritis. So I wanted to show you guys, as a histology techniques lecturer, you know, I can't relay a lot in terms of the pre-analysis, the pre-laboratory analytical technique. In other words, the gastric biopsy. You're welcome to go and Google that and have a look at how these biopsies are taken. What's important for us, though, is that you handle the specimen with the utmost care, because it arrives, it's quite small. It's gastric biopsies, those are tiny. I mean, they're taken and you're looking at really small, you know, 10 millimeters or less by about 7, 5, 6, 7, 8 in diameter. And the analysis that we do, that we teach you guys, is to look for infection and neoplasia. I would say the two important avenues to go. And so there's specific stands. This, I'm assuming, it could be crystal violet, because that's also used, I think, to stain up the bacterium. It's a spirochete, and gotta have a chuckle there. It's described as being in the mucus, of which the element, the essence, is mucin, right? And I thought this was quite a brilliant picture, so thank you, Ed Uthman. And you can see his credit at the bottom if you want to go look at some of his other photographs on the Creative Commons site and also on Flickr. Let's have a look at the specialized stain, guys, which we will look at in our study notes and in our theoretical lectures. The Gimser stain, which is also applied to stain up the Helicobacter pylori. Just a note here, guys, look how tiny it is. This is a epithelial cell. I'm trying to give you the dimensions here. I mean, this is really small. Excuse me, that's your surface area of one epithelium columnar epithelial cell, and then if you look at this little guy, it's really small. So we spend quite a bit of time, the pathologist will, I'm assuming, to look to identify this microorganism. Of course, every stain has got a control, so we'll have controls in this to positively identify it. Okay, here we have the Gimser stain, and it is in the laboratory where I worked. That was part of a specialized protocol or special stain done at the cut-up or anatomical dissection, meaning when a gastric biopsy came through, sometimes in conjunction with an esophageal biopsy, then they would do a routine. It would routinely be allocated as a to be done, have a Gimser stain done on it, and you can see it's ubiquitously blue. Okay, it's throughout. It's just there's no contrast, nuclear or cytoplasmic, just deeper blue or deeper shades of blue. So it's specifically for the microorganism. Now, at low magnification, I'm guessing this is about times 10. And then as we go closer, it becomes that spirochete morphology becomes easier to identify. I'll be back. And you can see this morphology. Interesting, isn't it? So have a look in the laboratory when you're there and ask for a control, and let your eye settle on it, and get used to the presence of these. Cell debris and a heavy mucoid specimen could make it really tricky to identify these organisms. So I wanted to do this as a preamble, this video, and just to show you, I have lightened the images and focused them a little as well, just to make it clearer, because microscopy and digital photography is sometimes a tricky thing when dealing with attachments to microscopes and things like that. And so this is a Gimser stain, and the previous one I think was possibly crystal violet, if not H&E. It was difficult to see because of there wasn't. Okay, so there is a nucleus there. It is purple blue, so it's quite possibly H&E. I should know. This is a absolutely stunning photograph of, also by Ed Uthman, showing the histological details here, and it's truly just a classic H&E, where you have the 3 variations of the eosin, and you have the beautiful purple blue of the hematoxylin nucleus stain. What I love about this image is the focus. It's just so crisp, and the inscription says gastritis, which it appears to be in the submucosal glands. Is an enormous amount of scarring. If you look here, the collagenous tissue, which is typical for fibrosis, is deposited, and the apical or surface glandular material is it's broken up, and it appears damaged, and it's difficult to assess on the surface glandular material alone whether there's pathology or if this was just mechanical. I'm not familiar with the procedure of a biopsy needle and whether this search came up as a biopsy, gastric biopsy, so I'm not familiar with whether a biopsy would disrupt the epithelium to this degree. Having said that, though, the epithelium looks attenuated and flattened, and this tissue is almost anaplastic, and the nuclei are pyknotic with perinuclear spaces. So I'm not sure if there is a changing pattern happening here due to chronic gastritis. So definitely a severe case of gastritis persisting here. Not the norm at all. Okay guys, this was just as introduction, some interesting points to make about the gastric biopsy. Your comments are welcome. Take care.